and several people that are here today. And we kind of want to, but the reason that we're here today is that we want to expand it because we want you all that are on the pandemic response team to also be part of this project in different ways. So as we go through, just sort of kind of think about how the work that you're doing can intersect with the work that we're doing. So the idea of this project is to use the data that we can collect on COVID, which is through different channels, to actually make decisions about where should we direct the information and the education, and how can we get people everything that they need. So you may or may not have seen the latest report that we did, but this is a follow-up to work that I've presented before on the disease distribution in Chelsea. And so this graph here actually compares who is being affected by COVID. And so if you look at the colors, the gray is March to August. So this was the first wave, and that really hit the retired community. That's why we saw that massive surge also in hospitalizations and in deaths. And then as the year went on, we saw that the virus shifted to workers. So essential and non-essential workers. And in the second wave that we had from November to January, we really see the surge happening in essential workers. And this was the peak that we had over the holidays. That was, it started around the 26th of November and it lasted until the second week of January. So that was definitely, you know, there's sort of some Halloween stragglers, but it definitely got started over Thanksgiving. It went through December and the New Year. And that was almost a predictable wave that we had talked about, and that, you know, that we were getting over 300 cases a week during that time. Things have gone down since then, but at the same time, we do want to be aware that, you know, in situations like, you know, like in future predictable waves, we can do something about it in a more data-driven approach. So I'm going to hand it over to Barry, who's going to talk about one source of data that we've been collecting to guide this project.
Thanks, Cris. And so just for a quick context too, there's been a group kind of throughout the pandemic involving hospitals, municipal leadership, community health, that have been talking a lot about how cities and towns have been responding. And kind of through those conversations, we continue to really focus on this idea of we really stop some of those issues and kind of people getting infected, the transmission that Cris was just talking about, by really kind of compressing the time between how soon we know there is going to be kind of the risk of transmission or someone being infectious, identifying that they are infectious, and then providing the support so that they can isolate or quarantine if they were a contact. And so we've been looking at various methods to do that too. One of the ways that really was discovered, I think, or kind of revisited early in the process, was to think about, can you actually look at viral shedding? So just as much as it might be coming out someone's nose as you're breathing, you also shed virus in other ways. And one of the ways is through our waste. And so we're able to monitor wastewater in the area to see essentially like what is happening. And there were some thoughts just with these three here of like, can it tell us when we're about to potentially see a spike or a surge? Can it tell us essentially when we're having rises and falls in terms of the amount of cases we might see and the amount of virus? Or could it even be able to tell us like how much in the community overall could we expect to have? And really what we've seen so far is it tracks very closely, probably more to the trend occurrence where we might see a spike, and a little bit to that middle one where we may actually see kind of a recession in it. You can go to the next slide. And so what we had the opportunity to do to the partnership Cris was just talking about was actually to look at, were there ways for us to delineate specific areas within the city where we know that essentially the waste that we're looking at is just from kind of neighborhoods or from essentially kind of residents and businesses within the city of Chelsea. And so what you'll see here is 4 highlighted areas where we're able essentially to know that there's a sewer juncture point where what we're seeing in that particular, we were calling them sewer sheds, but essentially that idea where all that's being captured, we can be able to get a sense of, again, in an anonymous way, not associating it with anyone, just to know essentially like in that particular area, what is the level of virus in that particular area? And can we begin to use it as kind of an early monitoring system to say, hey, levels are still high, or we might be expecting kind of a potential kind of uptick in cases in that particular area based on the amount of virus that we're seeing in the wastewater. And so we've been able to delineate that and look at that. And so we've been able now to be able to look at that information for Chelsea to understand what it can give us in terms as a leading piece, but to understand what that tells us kind of now and kind of moving into the future of what's going to happen with that. You can go to the next slide. So we've been monitoring this data since November and trying to really at that point too, because our viral concentrations were jumping all over the place to kind of get a sense of where we are and how to read it. But really what to kind of echo what Chris was seeing, what you can see, particularly looking at the blue dashed line and the orange dashed line, which are kind of moving averages of the analysis that we were getting, that we were essentially seeing kind of higher levels of virus within the two of the areas that we're monitoring at the time, but being able to kind of watch that to see, is it kind of going to go up? Is it going to go down? And now we're at a point too where we've actually kind of found the level that's probably the lowest level. And that's essentially, you'll see the lowest line you see going across the middle there is kind of 1 million viral particles in the concentration that we're looking at. Now we're essentially at a very kind of much lower than we were. And so it's at a point now where we can really watch it to say, if we see some changes and see some upticks, it might actually be an early signal that we can get out there, test people, provide care, and kind of provide isolation and quarantine. I'm going to go, Chris, go one more slide. And to that point, we actually now are able to monitor all 4 locations that you saw on that map. And so those would be the dashed locations that you see on here. And so the way we're really beginning to read this based on the data that we've collected in the past and how we've been monitoring it is 2 pieces to say, are we seeing, well, I should say 3. One is to see, are we seeing places where cases are increasing? So at least at the moment, you can see the kind of red dash line spruce. That's an area that we're beginning to watch because we're seeing an area where, at least based on its measurements, it seems to be increasing. 2, what areas might not be kind of falling and at the lower level of virus concentration we'd want to see or kind of hope that we can have present in Chelsea. And so the light blue dash line, you can see that's an area that we're beginning to really, or have continued to focus on because it continues to have a higher level of virus concentration, likely indicating a higher level of cases. So we're beginning to focus on some of the work that that Dan was talking about earlier and Chris will talk about as well. And then 3rd, the smaller dash lines are what we're getting in terms of information from the larger MWRA system where they're doing similar monitoring. And so we're kind of doing that comparison as well to say, are we doing same, better, or worse than there? And that to kind of drive our actions. So this is really serving as kind of a background, hopefully early indicator, but also really a way for us to kind of provide action in terms of support and kind of focus to make sure, again, people are getting tested in a way that kind of meets them where they are, and then begin to kind of get the care and support so that we can make sure that people can quarantine and isolate safely should they be in that situation. Let me stop there and turn it over to Chris or to the next person in the presentation.
So Dan, do you want to talk for a minute?
Sure, thanks, Chris. So just a little bit of background as to what the heck the Chelsea Project is, right? So a while back, Karthik Dinakar, who's unable to join us on this call from MIT Media Lab, and also CCI, which is Center of Complex Interventions, which is an offshoot of MIT Media Lab, but not directly connected to MIT. They're the funding organization. They're the ones that have sought funding for this project. That includes obviously the wastewater monitoring, and also the as part of the response effort, we contracted with the La Colaborativa to hire 10 individuals that are serving as Promotores de Salud, which is basically a health promoter or an ambassador like they have in Revere. So Cris is basically, that's her well, she's contracted with the Chelsea Project as well to coordinate their efforts, but not just coordinate their efforts, but to train them and to get them into a public health mindset. And the goal here is to eventually have these people have a pathway to a job at MGH or Cambridge Health Alliance or CHA as a community health worker. So we have a pipeline of workers from Chelsea feeding into our local health institutions. So one of the good things about doing things like wastewater monitoring or even the Promotores is it attracts attention. So MGB reached out to us. They basically wanted to know who, I think Mimi, they reached out to the city. They wanted to know who was doing the wastewater monitoring. So that's how we were able to partner with them, because their effort is to be a response effort, which means that they want to go where the need is. So initially we were, in the beginning stages, analyzing the data. We knew roughly what was happening and we figured it would be good to partner with the collaborative at the food pantry. We did that for about 4 weeks. Of late, we've been more central, just a little bit more central, I guess, right at the Phoenix Charter Academy School. So the response effort really is related to what the wastewater monitoring is telling us, where the detection is, boots on the ground. You know, let's get out there and knock on doors. Chris can elaborate more on that. And it's been a really good partnership. They're also now partnering with, we're linking up, I should say, with the vaccination vans that are out there right now. When they're in Chelsea, they're currently lined up with the testing van, and now the promotores will be able to, you know, go alongside with the doctors and nurses to promote vaccinations as well. I'll pause there for a second. Chris, turn it back over to you. Oh, let me just add one more thing. I just saw his beautiful face right now. So one of the things was we wanted to do a video initially on testing. We needed to get people to keep testing because that's the best way to ensure that, you know, because a lot of folks that are asymptomatic are still spreaders. So we wanted to make sure that we promoted testing. But at that point, at the point of producing the video, the conversation really has shifted to vaccination. So we made this incredible video that Dr. Ephraim Flores from MGH was a big part of, as well as Father Edgar and a local business owner from Catrachos right on Broadway. And who am I missing? Oh, Jesus Christ. And Gladys Vega. So Gladys kicked it off. It's gone semi-viral. We're approaching 6,000 views, which is a lot for a locally produced video. I'll pause.
I'm back. Sorry about that.
Oh, Chris, I'm done. Are you there?
Yep. Let me just get the slides back up.
Dan, this is Ephraim Flores. I just want to say thank you for the opportunity to contribute to this. I mean, the city of Chelsea have done so much, and it really received me with warm hearts and open arms. And you know, anytime I walk, like the other day, I was at the community care van, and just like walking around, it just feels like I'm back home in Puerto Rico. So you know, this is the seriously the least that I could do for the community. And thank you for trusting me to be part of the incredible effort that you and others are leading. The work that in Chelsea, that is happening in Chelsea in terms of collaboration between the community and the healthcare systems, all of them is just a model that we should follow across the state, really.
So you got to thank Mimi for that. So Mimi had invited you to participate in the pandemic response team. I'm like, I don't know who this guy is, but we got to get him. So Leslie, I think, was able to track you down. So, but on that point, so the work that this is doing is aligning with the existing work that has happened through the pandemic response team, that is continuing to happen. And really, if there was a model, and we're borrowing this from the Mission District in San Francisco, they have a very, very similar community, very similar to ours, and they're doing a lot of great work, and we're trying to model ourselves after. It's the pairing of science and service, right? So there's a ton of service. Everybody in the city rolled up their sleeves and kicked some serious butt, especially, you know, the pandemic response team. And how do we match science to align those current and future efforts?
Absolutely. I think that, and the other part is that, because I know that there's a lot of feelings and opinions about COVID, right? And there's a lot of differences, but like when you use science or like data, then the conversation becomes, I will never be able, and that's what I tell people, I will never be able to argue against feelings and opinion, because that's, you know, how people feel or how they think. But if we have data or science, like what you were saying right now with wastewater or other metrics, those are objective, and the conversation becomes more objective, and then we can have a conversation and navigate some of the differences. So
yeah, thanks, man.
Anytime, whatever I can do. Sorry, I don't mean to talk too much, but that's the Puerto Rican in me, but just want to say thanks.
Yeah. Chris, are you on? We may have lost her.
Yeah, I'm here.
Okay.
I'm here. Okay, great. So just to give sort of the third part of this is, so what we're doing right now with the Promotores is we're really pushing them on street outreach. So we've got a couple of things going on. The first thing is that they're going to be on Tuesdays where the van is, and they're going to be in the streets surrounding the van to try to get people excited about coming, get people pulled in, and really push regular testing as, you know, as a ritual that we all have to do every week until we can all be vaccinated. They also have a schedule where what we're doing is we're linking them to the neighborhoods or the areas that Barry is identifying through the wastewater. So the last couple of weeks, they've been targeting the Crescent area, and they've been going door to door, letting people know that the COVID rates are higher in that part of town, letting them know that the testing van is going to be there on Tuesdays, and also keeping them informed of other things. And so what we, you know, in the sort of community health model, we want to make sure that they're super informed on what are the community resources in terms of social protections. I also keep them up to date on what the vaccine situation is. So, you know, what was happening with appointment scheduling. The phones are open now. The website is working again. So letting people know that they can make appointments again, and also recruiting people who are unable to make appointments. So one of the things that we want to be able to do is certain people can't make appointments for whatever reason, and certain people are homebound and they won't actually be able to leave their home. So if they can identify people who need assistance to make the appointment, then we can get their information so that we can set them up. And so they're working, you know, they work 6 days a week, every day except for Friday. And they target different areas. So for example, they target, on Wednesdays, they target the diaper line, because that's been identified as, because the Colaborativa is the only space that's giving out diapers, the line is, you know, it goes up for several blocks, so that they know that that's a target population, especially because that's sort of the age group that we're trying to target, which is workers in their mid-30s. And they're also going to be on Mondays, they're going to be around the Compare store, you know, sort of like around that Phoenix Academy area, handing out flyers, handing out masks, and getting people excited about the van coming Tuesdays. So they're trained on Thursdays, and, you know, we're just sort of wanting for them to make sure that they're able to translate to the community what's going on in terms of COVID resources and outreach that's available to people so that they can access that easily. And one of the ways that you can help us is this Facebook site called Resource Chelsea, which Dan said he founded a couple of years ago. We will be changing the name, but we haven't quite decided what that name is going to be yet. But if you or your organization could like that page and share the updates that we put on there, because that's sort of like the latest COVID information, or if you have anything that you want to post on there that you want us to share, that will also help get the word out. You know, we're going to start doing Facebook Lives on Tuesday so people can see what it feels like to get the self-test, etc., and try to make some noise and get these promotores, you know, give them a space in the community so that people know who they are and know that they can reach out to them. So that's all from our end. And really our ask, or the conversation that we wanted to have tonight, is, you know, what are ways that we can outreach better? What are ways that we can interface? Are there ways that the promotores can be useful to your organization? Are there spaces where we should be door knocking? Or, you know, are you preparing some sort of event that you want the promotores to go to? You know, ways that we can we want this to be a community effort. So you just sort of think of ways, either, you know, right now or in the next couple of weeks, if you think of something that we could work together on, it would be really great.
Yeah, you know, a big part of this would be, in a way, I guess crowdsourcing would be the best way to look at it. It's how can anyone in the community be part of supporting you know, the efforts of the pandemic response team, of the city, of everybody that's doing this work, and you know, basically volunteer, opt in, participate in this, share information. So whenever, you know, the Sabías Qué earlier, I don't know if everybody heard this, but we came up with a campaign called Sabías Qué, and this is obviously targeting the Latino community, but there's Sabías Qué, did you know, basically. So the students at Endicott College, the graphic design kids, are have come up with some really good concepts, and we're going to be narrowing down the choices here real soon. Chris and I, if anybody's interested in looking at those, Mimi, I emailed those to you. We would use that as a campaign where bits of information get sent, sort of meme-like, and we shoot those out, and then we're hoping that everybody, when they see those postings, that they could share amongst their organizations, their own personal pages, etc. Just the more, because people are becoming complacent. People are not getting tested right now, and we've approached a lot of folks, especially in the food line. I have never been tested, or I got tested in March or April at the height, and I was negative. So one of the things that they did in San Francisco, because they had no testing, they had to fight the city, the Mission District, they had to fight the city to bring testing into the city, is they created a testing culture because it was a very grassroots oriented movement. In Chelsea, we probably had more testing opportunities per capita than anywhere in the country. So I think people were getting tested in the beginning, but now they're like, they walk by testing opportunities every day. So we're trying to get people to get in the habit of, Chris is saying, to get tested on a frequent basis, especially the asymptomatics. One of the main things that people say is, I don't have any symptoms. I don't have any symptoms. So that graphic that Chris showed earlier is part of that Did You Know campaign. And that way people feel like, okay, I don't have symptoms. Maybe I should. And we were pulling people off the sidewalk. So it's going to be Part Tuesday. If you want to come by, we're trying to make it a festive environment with music. If any organizations want to set up a table, it'd be great. Yes, and we have Kelly Orlando on the call. If you wanted to talk a little bit more about your Stop the Spread site.
Yeah, well, no, and I also wanted to say, if you could just send me a quick blurb about the time and the location and the date, because I'm thinking that we would love to be able to set up a table and participate. Yeah. So thank you. And yeah, just as a shout out, it just warms my heart to know, or to think, that Chelsea, in comparison to so many other severely impacted cities and towns across our nation, had such the opportunity for available testing. Just to give everybody a sense of resource availability, is that the Beth Israel Deaconess Healthcare Chelsea testing site continues to be open 6 days a week. As of this point, we continue to be a Stop the Spread provider with the Department of Public Health. Our contract is through March 31, and we will be reaching out to them to ask them about what they're considering for an extension. And I think that we have such amazing nurses and follow-up and education and counseling available to patients regarding COVID. So just please know that we continue to be available for our communities.
I guess maybe we could open up for any questions. And while people are coming up with questions, there's something
I asked
else.
a question on the chat, Dan, just about kind of addressing the other populations that aren't Spanish speaking in the city. The Sudanese and Somalian families seem to be really increasing at Chelsea Community Connections, which is kind of new for us. And I would love to have additional kind of supports and resources to encourage their, similar messaging, so that they are equally aware of what the resources are, what their concerns might be.
Yeah, and that's a really good example. Caroline's on the call, so Caroline and Rosie, I believe, head up the communications team. That's a good example of just partnering and saying, listen, let's do a Sudanese, like when they did their flyer, when Green Roots had their the pop-up testing and food distribution about a month ago, they had a beautiful flyer in multiple languages. So that would be a really good opportunity to translate whatever it is that we're producing into those languages as well. Now this was focusing on the Latino community because that was the bulk. That, if you had to pick one, that was the highest number group. And everything that you see is like in English, and then it gets translated down in Spanish. That's why we made the decision to make the video only in Spanish. That way it doesn't feel like it's too messaging. We may actually produce it. We may actually create another video with subtitles, but we felt that it would take away the impact of that message. Like if you notice the video doesn't talk, it doesn't fight. It's not a science oriented talk like a lot of the videos that are being done, especially with doctors. This really pulls at your heartstrings. You know, some of the things that Efren says, some of the things that Gladys says, and Father Edgar, they're very moving. We've had a lot of people say that I showed my family member that was hesitant that video, and now they're getting vaccinated. True of my dad. My dad, for some reason, didn't want to get a vaccine. He saw the videos. Okay, mijo. That's out in Arizona. So, but yeah, well, point well taken.
It's just the video is fantastic, absolutely, but it's just a population that I know kind of wanders and has to try and figure out how to navigate lots of things within the city that it's, again, not the bulk of the population, but still significant enough numbers and probably contributing to spreading and having misinformation around vaccines and testing as well.
You know,
because
that's a really,
they're relying on each other versus, having one of the messages that I try to portray on our Facebook page is often, seek medical advice about your medical situations and not from your friends and family for that information. That's a big push. But then if you don't have representation of that within your culture, it makes it difficult to get that messaging across.
Yeah, and that's precisely why this campaign was started. So it's a good opportunity to branch out. I mean, I think that's something that MGH with the Chelsea Housing Authority, because a lot of the folks do live in some of those properties, with the city, can partner up on an expansion of the campaign that we've created. Really, any campaign should be in as many languages as possible.
I have a question about the case data. Chris, maybe you have the information on this. Seeing the shift in terms of number of children that are now, or at the latter part of the pandemic, testing positive, is there some tracking to find out how they got the virus, especially thinking about schools starting to reopen?
No, there's not. I mean, that's a different level. That would have to be analysis of contact tracing, which hasn't been done, and there's so much privacy issues around that. But no, I just can tell you the numbers. I can't tell you the why behind it. Yeah.
Do you have a sense in terms of like the amount of testing for children overall? I know for a while that there was almost no testing of kids, so it's hard to know whether that's really infections are up or.
No, I wouldn't even be able to tell you how many children are in Chelsea. So what the denominator of the total number of tests are, yeah, my focus has been more on the adults. So, yeah. But one of the things that we talked about just today with the health promoters is letting them know that parents, when, while they're pushing regular testing, the parents also recommended the kids get tested because the kids can be transmitting. So, yeah. Something for children to take on.
We've been tossing around, an idea that we've been tossing around is potentially creating a, when we came up with all the teams for the pandemic response team, that maybe there's one, maybe it's, I don't know, COVID outreach team. We've been working a lot with Flora, and we're creating this little sort of support group for her, that maybe if anyone is interested in being part of a group that continues a conversation like what Kara has said, Caroline basically said, let's do that. Let's work on the youth component. We could get some working groups going and report back as part of the pandemic response team. The other part is, and Barry, I don't know if it's too soon to mention this, but we are in the process of procuring a bunch of rapid tests, the fast ones, and how potentially that could help ALMI with reopening. But I also think that the state is going to be providing some of those anyway. But Barry can talk a little bit more about that.
I think it's just so consistent with being able to kind of identify people early so that they kind of know what situation they're in, but then again, that they can also be matched with, I think, some of the work that you all are doing, but that Cris described too, moving towards a manner where we're not just using the testing to diagnose people, but we're either kind of screening or conducting some type of surveillance so that over time, we're kind of checking people, and it's a way essentially that you can both kind of, whether it's somebody coming to your home or business, or you kind of going to a particular place, or even kind of working with a family, to know when that's happening too, and feeling like that's a much more kind of both sustainable and less intrusive way to do that kind of testing, and kind of a way that also, I think Dan may have mentioned it, but building a culture where understanding testing is kind of part of public health. Like, it's a good thing just to kind of do that, just like getting vaccinated is a good part of public health. And so not making those feel like it's an ad, but it's part of essentially like you do, like wash your hands or make sure you're kind of doing those things. It's a good practice. So yeah, we're trying to see whether or not that's also something that can be leveraged among the other great work that's happening in the city.
Yeah, and the overall goal of the project, from a broader perspective, obviously it was like the immediate goals are monitor the wastewater, respond, and get resources to the city. But a big part of it is building a very comprehensive, resilient, collaborative public health infrastructure in the city. With Flora on board, and Cris, I mean, we're just quite frankly blessed to have both of them in the city. We really can make public health a priority. Not that it hasn't been in Chelsea, but make it a serious priority, not just for COVID, but for, in 2 years, making sure that everybody gets their flu shot. What they did in the Mission District in San Francisco is they had people that didn't even want to get flu tested at all. To now they're telling the neighbors, come on, vámonos, we have to get our COVID this week. So it's a culture that can shift here. So this is something that can be long lasting in for years to come in terms of either new viruses or even with the variants, right? And that's a very important part of the wastewater monitoring. But anything that's a public health issue, we need to have a city grassroots, with the residents, community-based organizations, very collaborative and comprehensive, and utilizing science. The folks at MIT, MAPC, very pretty much has kept everybody together on this effort, and it's very exciting stuff.
So if you come up with ideas, definitely, Kara, there was a comment in the chat box, and I would second that. If you have any leader identified in the Somali community that we can link with, that would be amazing. If anybody else wants to come out and be at the van, or has, for example, somebody mentioned a bunch of other diaper lines. If you have places where you think the Promotores should go, we're definitely prioritizing the high incidence, the high wastewater areas. But I want you to know that the more that we can link with other organizations, sort of all of us working together to promote testing and to make sure that vaccines are accessible for the people that are eligible, it'll be great. So I'm going to leave my number in the chat box and my email so that people can contact me as well.
And Lisa, yeah, so the pool testing is something I think they're already doing. I think they're one of 6 or 8 districts in the state that were doing the pool testing. Actually, pool testing was one of the first things that Karthik had mentioned, when he called about, trying to get MIT to support what's happening in Chelsea. And, I brought him over to the Tuesday call that Barry runs, that he mentioned earlier. And the conversation evolved to wastewater monitoring, but now we're back at testing, which is incredible. We think that the rapid tests are going to be a game changer, especially with getting, obviously it was just announced that teachers are not getting vaccinated, which is, can't believe that wasn't part of day one, but it is what it is. And, we want to, everybody wants to support ALMI in making sure that our kids get back into school safely and securely.
Well, thank you all for so much. If everybody's all set, thanks for sharing this information. Thanks for multitasking, Christina, and for the team that have been literally going to the depths on our behalf and doing the testing. It's really been helpful. I'm going to put the recording up on the Chelsea Prospers Facebook page, and actually probably just our YouTube. So I'll put it on the Airtable if folks want to look at it again to see the slide presentation. Unless there's anything else that folks want to share, we can wrap it up. No. All right, thanks, everybody. Have a great night.
Thanks, everybody.
Bye, everybody.
Bye. Bye.
And thank you.